Real Country 1430 AM and 107.3 FM WRDN. Good afternoon. I'm Brian Winnikins, and joining us this afternoon, Pepin County Health Officer Heidi Stewart, as we get an update on our COVID-19 situation. And Heidi, thank you for joining us once again today. Well, I know you have an update on some of the numbers here in Pepin County. Tell us about that.
So numbers continue to be pretty stable. We peaked earlier this month, or actually earlier mid-November, and for the month of December, they've been pretty stable. Our daily average case counts are approximately 7, and that has been pretty consistent. If you look at that Harvard map, our case counts per 100,000 per day, when I checked that today, was 98, and that's based on our population and the number of cases we have each day. For the state of Wisconsin, it's 77.7. So we are a little bit higher than the state average. Our total number of cases is 546. 63 of those are active. We have 3 individuals currently in the hospital, 20 individuals total who have ever been in the hospital. And today, I'm sad to report that we did record another COVID-related death. So that brings our total up to 3 COVID-related deaths. I did work a little bit this morning on trying to determine, the state actually had us at 3 deaths earlier today. So this one would be a 4th, but I've not really been able to determine where that one would come from. So there may be a difference between what we're reporting on this call and what you're seeing on the DHS website. And I can't explain that at this point. I have tried to figure that out, and I can't. So
Heidi, is there a concern? I know there's some folks talking about another surge after Thanksgiving. How long do we have to wait until that's either confirmed or it's not going to happen? What's the timeline here?
So actually, that actually leads me into the next topic that I wanted to talk a little bit about. And I believe right now I'm sharing a chart on the screen.
Correct.
So, as you can see here, let me diminish this a little bit so potentially the whole thing can fit on. What we see here is some specific peaks based on some specific activities. So we know that Thanksgiving was here. We did see a small increase here right after Thanksgiving, where we had more individuals tested. I think it's significant, and we know that there's been an exposure, and we know that people are having symptoms. So this week immediately following, on this particular day, 22 people were tested, 16 tested positive, and almost another week out from that, 34 people tested, and about 50% of those tested are testing positive. What this graph shows us in the blue is the total number of people tested on any given day. And the green color then is the amount of those tested that are testing positive. So you obviously can see here the weekends where the testing drops down a little bit, where we don't have local testing happening. You definitely see an increase when we have a wing testing site, the Wisconsin National Guard testing sites, when they test, 50 people on one day, you see those peaks a little bit. So I believe this would have been around one of those timeframes. So the testing definitely correlates to the number positive. I don't even remember if I remember what your specific question was, Brian. It was,
well, the timeline. I mean, are we
seeing a direct impact from different activities? I don't know that we have seen a direct impact from Thanksgiving here. The incubation period, they still believe the incubation period is between 1 and 14 days, with the majority happening in the first 5 days. And then the second portion being the following 5 days after 10 days. We're not seeing a lot of that. And that leads to another topic of the quarantine that we're going to talk about today. But before we move off of this screen, I do want to point out something here, that we have had since the middle of October, the trend line of the amount of testing happening each day is down. So we do have testing available in our community. We do have the wing sites coming now. We have Advent Health in their testing capacity, and then our neighboring communities. So if you are having symptoms, please be tested. If you have been exposed and you're interested in this, the new guidelines put out by DHS, the CDC and DHS, testing, we might see some testing increases as people look to maybe get out of quarantine a bit early, or to change the way they're doing their quarantine a bit early. So testing's available. It's important for us to continue to do testing. I think I've
And Heidi, for the Pepin County tests from yesterday, did you get any numbers of how many were tested on Tuesday?
Midday yesterday, I had received a report that there were 25. I do not have the total tested through the rest of the rest of the day. I have not received from the National Guard the breakdown. We will receive, typically within 24 hours, we will receive a list of the total number and their addresses. So we'll know how many were from within the community, but we know at least 25 were tested. That was midday yesterday.
Is another test for Pepin County being scheduled, or are we still waiting on that?
So there is nothing scheduled at this point. We have applied to continue our testing through the National Guard on a routine basis at the beginning of the year. The National Guard has been extended through the end of March. So March 31st, we do have this available to us. Some of the key players in determining where, when, how often have been having discussions, potentially looking at maybe a Pepin site or an outlying site outside of Durand as an option, because we do have the testing resource here at Advent Health, maybe extending that to the southern portion. But none of those decisions have been finalized. It's just discussions. We have had an application go out, like I mentioned, that we do want to continue to do that as long as we get the good turnouts.
Talking with Heidi Stewart, Pepin County Health Officer. Heidi, we have had some changes from the CDC on quarantine, and that's happening now, I guess, in Wisconsin too?
Yes. So here is another form that I want to go ahead and share with those listening on Zoom. The CDC came out with it. Are you seeing it now, Brian? Yeah. The CDC came out with some guidance on quarantine. I think it's really important for people to remember and to know this does not affect people who test positive. This does not shorten an isolation, which an isolation is when you're positive, you're shedding the virus, and you're isolating yourself away from others. This quarantine protocol and the changes to this relate to those people who are close contacts. As I just mentioned, we are seeing the majority of individuals who are exposed become infectious within that first 5-day period. After that, the infectious and the rate of developing the infection drops after 5 days, and then after 10 days, it seems to drop again. So there's between a 1 and 10% chance that people after day 10 will become infectious. So the CDC and the Department of Health Services continue to encourage people to complete the full 14-day quarantine, where you're staying away from others, you're monitoring your symptoms, socially isolating, all of those previous things, but they have come up with some alternatives, especially in situations where people need to get back into the workforce. There's options now for people who need to return to school to in person. So we'll start first with the 10-day quarantine. And as you can see on here, it does continue to do symptom monitoring. Everybody through day 14 needs to symptom monitor whether or not they change to the 10-day or the 7-day quarantine. Symptom monitoring needs to continue to happen. If anybody develops symptoms, they need to go back into quarantine as quickly as they possibly can, and we would strongly encourage a test. So if you've completed 10 days of a quarantine, you're not having any symptoms, you continue to monitor, you can return to work or school on day 11. If you're completing the 7-day quarantine, you've completed 7 days of it, of symptom monitoring and quarantining yourself away from others. You have no symptoms, and you go in for a test. That test needs to be collected on day 6 or day 7. And with a negative result on day 6 or day 7, you can return to your school or work activities on the 8th. One of the really important things to know about these recommendations is that they are not encouraged for people who after day 8 or after day 11 can't wear a mask and wear a mask properly, can't physically distance and stay away from others, and can't avoid gatherings at whatever they're going back to. So there's been a lot of discussions and a request for some further guidance. What does this mean for schools? What does this mean for daycares? What does this mean for sports? What does it mean for some employers where the physical distancing might be an issue as they return? I myself am looking for more interpretation on that and some guidance on that, and we'll be sharing that as soon as possible. But at this time, we are adopting, as far as the Pepin County Health Department is concerned, we are adopting the CDC and the DHS alternates as an option, and we're working with some of those key partners on how to interpret it and how to apply it within their facilities, whether it be healthcare, whether it be education, or a business.
All right. Well, Heidi, some great information again, as always. We appreciate you joining us today. We will talk to you next week.
Thanks, Brian. Hopefully I'll have some more information next week about vaccines. There really hasn't been any new news coming out in the last week since our last interview. I have had some individuals reach out to talk about phases and how people are placed in, or organizations are placed in different phases. And at this time, the Pepin County Health Department is going to be strictly adhering to the CDC and the ACIP, the Advisory Committee on Immunization Practices, and the DHS guidelines related to who should get it, when they should get it, and how it will roll out.
All right.
More to come on that, I'm sure.
All right. Heidi Stewart, Pepin County Health Officer. You're listening to WRDN.